be rotating over to your left shoulder, and then over to your right shoulder. Perfect. And you can show them what to do. You can give a demonstration of how to do the movements as well. At this point, it's very easy. So you've got, so do it again. So go your left side, good, and then right side, good. Muscles that help with rotation are your sternocleidomastoid and your scalenes, and you looked kind of the same on both of those. But did you feel any difference between the two?
No. However, the other day, he assessed me and said that bit, was it you one that said that this one is like denser and thicker than this side?
Mm-hmm. Okay. So
lateral
flexion
through that side
would be affected with your trapezius muscles on those ones. So rotation for the C1 and C2, the pivot joint, atlas and axis. Then you've got the rest of the cervical spine. Now all of the cervical spine will move together, and the alignment of the vertebra will dictate the amount of movement that you've got. But you can do lateral flexion, which is ear to shoulder, ear to shoulder. Any differences on that side? The shoulder elevates, like you were saying, tightness on that side. It elevates on both sides. Feel a difference between the two?
I would say that that's more like strained.
Yeah.
I feel like I'm trying to like pull more, it's shorter.
You can see scalenes posterior popping out of your neck. You've got scalenes middle coming out of your neck. Sternocleidomastoid coming out. So you can see lines of tension in lateral flexion. You can see it and you can palpate it. These two feel quite tight. Coming around the back feels tight as well. You've got trapezius and levator scapula around the back as well. Good. On the other side, to the other side. And again, you can see really strong muscles coming out of each one of those ones. Good. Chin to chest is assessing like splanus cervicus, splanus capitis around the back, erector spinae muscles around the back through here, levator scapula in that one, and still trapezius muscle. In there as well. Any pain there?
Mm-hmm.
Yeah?
Like
All tightness all the way
I can
around?
feel it going down slightly.
Yeah, okay. It's all the start of a neural tension test, assessing like stretch on the spinal cord. So you've got a little bit of tightness running down through the spine in there, and up towards the top, right scapula. Good. You could then move. Let's go into the thoracic region of the spine. Hands across the chest or onto your shoulders, and then if you rotate towards this side. Good. So about 45 degrees of rotation to the thoracic spine. Thoracic flexion would be to slump, so to bring your shoulders down towards groin. Good. And then back up. Good. You could look up as well and do thoracic hyperextension. You've got cervical going on because you're looking up as well. So but it doesn't matter. You're just assessing the whole of the cervical spine. There you go. Lumbar would be lateral flexion. Across, back to centre, lateral flexion. Back to centre. You could do flexion as well as to kind of bend forwards and touch your toes. Lumbar, about 5 degrees of flexion going on the lumbar. It all comes in the thoracic spine. So you could go into a more functional screen and actually assess all of the spine together by getting them to stand up and touch their toes. Okay?
Stand.
Do you want to stand, touch toes? Now. This might be an issue. No, it's pretty good. But what you've got here is really good hamstrings. Sorry, really good hamstrings. Hamstrings are allowing the whole of the hips to turn, and then the back is still staying quite straight in this position here. So there's not actually much bend going on in and around there, and it's pretty much straight all the way through. So you've got really good hamstrings, but it hasn't really enabled us to figure out what's going on, if anything, at the spine. The spine's still pretty much straight and rigid. So assessing the spine is really difficult because it's a, thank you, go back up, let the blood go back. It's the joint is fibrotic, it's fibrous. Each section of the vertebra joins together to create a greater range of movement that's going on. So you've got like 5 degrees of rotation in each thoracic vertebra, bringing it all together makes 45. So assessing each part of the vertebra in isolation, with probably the exception of the cervical spine, is quite tricky to do. So I tend to quite like to do functional things like touch with toes, sit and reach test, those types of things for assessing the spine.